Hello, everyone. Thank you so much for coming to the opening reception and the gallery talk for Beauty as Currency by Paige Greeley. So as you guys know, my name is Todd Jones. I'm the gallery director here at Meredith College, if you guys don't know. We're really excited to have Paige here. Unfortunately, Paige could not be here in person, but we're lucky that she can join us through Zoom and still present her talk and to engage with us here at Meredith. So I'm gonna go ahead and introduce Paige, and then from there, I'll hand it over to her and she'll give her artist talk and presentation. So Paige Greeley received a BFA in Fine Arts from Meredith College and an MFA in Painting and Drawing at Ohio University. Greeley has exhibited paintings at the Grease Gallery and Booth Gallery in New York City, the Dark Art Emporium Gallery in Long Beach, California, Nasty Woman exhibitions throughout the US, the Photographic Resource Center in Boston, Roy G. Biv Gallery and Wild Goose Creative in Columbus, Ohio, along with Arch Enemy Arts in Philadelphia and Gonzo in Florence, Italy. She's had solo exhibitions at Local 188 in Portland and Ohio University Art Gallery. Greeley was awarded the Presidential Medal of Creative Excellence at Ohio University in 2020. She currently works as a birth doula in Philadelphia, supporting new mothers and parents in pregnancy, childbirth, and postpartum period. Please help me welcome Paige Greeley.
Thank you. All right, let's get started. Thanks so much for having me. I was reflecting on some of the last times that I was talking a lot about my art, which was in grad school, where you talk about your art every single day. And then when you leave grad school, you're like, oh, I'm so happy I don't have to talk about myself anymore. And then you welcome opportunities like this. So I'm very happy to be here, talk about these things. So this show was from my thesis exhibition, but since then I've become a doula, and things have changed, but I still think that this body of work is very relevant, but I kind of have a whole new viewpoint as not only just an artist, but also as like an active doula here in the city. So this talk will kind of cover what you see in the gallery, and then I'll also go into my work as a doula, and then I'll try my best to connect those two things. And so it'll be a little different than an artist talk. It'll be like an artist / doula talk, which I'm super excited about. So yeah, this is my talk about the intersection between beauty as currency and women in childbirth in Western culture. Before we get started, I just want to give like a little content and language warning. I want to note that the language I'm using is super binary, right? So it's very much like a woman and man. I am speaking from my own experience here as a cis woman, and I don't want to exclude people that don't fall on the gender spectrum in that binary. I think that this is still very relevant to anyone on that spectrum. But just speaking from my own experience, I'll use the language woman, but I don't want to exclude anyone here. Also, I'm saying Western culture a lot. So again, I think that this concept exists in all cultures, but I just want to speak specifically to being a girl in the USA and my experience there. So yeah, it's not limited to just that. Lastly, there will be a lot of like birth imagery in here, which contain like a lot of blood. They're kind of just like shocking images. So just giving you a little warning there that content will come up, and then I'll talk a little bit about sexual assault and rape culture. So if that's triggering for you, just know that that's going to come up in the talk. So hopefully all is well with that and we can get started. So I created this body of work during my thesis year of my master's program at OU, where I met Todd. That is a great reason to go to grad school, just to make connections like this. And in this body of work, I was wanting to explore how this damaging force of beauty as currency was on the Western woman. So I examined my own experience of adhering to the idea that beauty is considered a woman's most valuable form of social currency. Feminine beauty is culturally defined, and it's always been a form of wealth in the West. So after graduate school, I moved to Philadelphia and I became a birth doula. We can sidebar on that process at the end of the question and answer if we want to talk about what being like a working artist looks like. that's outside of academia, because I always thought I would land up in school and I didn't. But yeah, so since stepping back from this body of work in particular, I've attended about 50 plus childbirths from start to finish, and I've supported a lot of people postpartum. And now I can notice those disparities between beauty as currency and the birthing woman. And I believe that a woman during childbirth is a true rejection of this beauty ideal, whether the participant knows it or not. And this is not to say that birth is not beautiful, but rather it's a scenario where the most important aspect of a woman's body is not beauty, but its function. So I also want to note that the decision to not give birth and not have children can also be seen as this rebellion against the patriarchy. So in school, I did a lot of studying on the waves of feminism, and boy, is it muddled now. It's very confusing what feminism looks like. But when we're looking back at history, we have the first wave of feminism in the 20s, and then we go to the second wave 50 years later. I have no idea what wave of feminism we are in now. I think that that definition of feminism is changing too. Even with the language being rooted like right with female, things are changing a lot. But when I was researching these waves, I really noticed my work and my interest falling back to that like 70s second wave feminism. So this was a time of rebellion, women's empowerment, and a rejection of what society taught us about gender equality up until that point. As we started to gain traction, especially kind of referencing this image here up on the screen, through different sort of protests and very brave things that women were doing. A lot of women artists such as Cindy Sherman or Hannah Wilke were making these really radical art pieces that I think were helping with the movement. But as we gained traction, the patriarchy started to set new control. So it's kind of like being one step ahead. And in my opinion, this was setting impossibly high beauty standards as the norm, as a way of controlling women and then further denying social equity. So moving back to today, or moving forward to today, I should say, many women in Western culture believe that beauty is their highest form of social currency. And so this means that beauty is ahead of intelligence and kindness and academic achievements and creativity. And in a way, it's true, right? Like, why should we as women believe that beauty isn't our highest form of currency when it's all we see in the media and in pop culture and history? And why, when we look at these successful women, they're also always beautiful. And you have to see the connection there. You have to wonder how relevant that connection is with beauty and success for women specifically. This image on the screen is a photo from Lauren Greenfield, who is a wonderful photographer. It's from her book called Girl Culture, who I took a lot of inspiration from in this body of work. She does the documentaries as well, some of which you may have seen, but she's amazing. If you're looking for someone like a feminist, iconic photographer, I totally would look into her work. So while I was in graduate school, I decided to volunteer at a local survivor advocacy program in order to ground my work within the community and also try to create social change outside of my painting. And I think this is really important as artists. Now, artists aren't just creating in the studio, but I believe that you're also kind of an active member of the community in order to make social change wherever that may be, whether it is like what I'm doing, which is more a feminist geared approach, or you could be focused on the environment. You could be focused on racism in America. So many different avenues. I think it's important to get into the community and just so eye-opening. So I was doing this at Ohio University in the town. And so unfortunately, sexual assault and rape culture was super, super, super prevalent. We heard about it all the time. Whenever there was an alert or someone reported an assault, we would get an alert. And it was sick how much it happened. It was super prevalent. So that also drove me to like wanting to try to do something outside of just painting and try to like get into the community. So my advocacy work at SAOP really taught me even more about how men control women. And rapists are almost entirely driven by this want of control and of power. It's often not necessarily about the sex, but it's about this ego and power. And that was really driven home in this long training that I did to work here. And it was very eye-opening, very disturbing. And yeah, I think my big takeaway from this was that our culture loves to control women. They love to control women's bodies. And it's really sad. So that was a good takeaway. And in the organization, I was a hotline responder. So I would kind of take over the hotlines on the weekend and some of the like week evenings. So if anyone were to call our hotline in crisis, I would be there to answer the phone. And we were also all trained as hospital advocates. So this is where someone who had recently been assaulted or even had been assaulted, you know, there's a range there. But if they decided to go to the hospital to get a safe exam, which is a sexual assault forensic exam, we were trained to go with them and kind of talk through their options. And obviously it's a super, super sensitive and vulnerable and intimate space. So we were trained to accompany them. So this all kind of like, all this stuff really goes into my doula work that I'll talk about in a little bit. Yes, so in this body of work, I'm examining the biological argument for the evolution of this behavior, the overwhelming social pressure to conform to this behavior, the subjection by the patriarchy, women's complicity, and the many forms of exchange involved in utilizing beauty as currency. So in order to create this work, I was combining my advocacy work on the rape crisis hotline mixed with my own experience as a woman to create these visceral and figurative oil paintings that examine the dangers of beauty as currency as it's inflicted onto women. Okay, so now talking about the work itself. I came up with this idea of the bodysuit. Like I kind of thought about this detachment from the physical body to like the woman, the ego, the self. And I thought of this idea of these like latexy suits that you'd like put on every day and you were forced to maintain these suits. So this was a social costume that women are forced to wear and they're maintaining them. And society in turn sees women merely as these bodysuits, which is this forced annihilation from their physical beings. And it's culturally dictated and a distortion of who and what we really are. The tiled background that I kind of set my subject in is representative of the bathroom, which is, I thought, was this area of self-scrutiny. Like the bathroom is where the beauty ritual takes place. The painted figures are analyzing themselves in the mirror. So they're looking right back into the mirror, analyzing themselves, in turn, making direct eye contact with the viewer, kind of confronting them on this idea of beauty as currency. And I think the portraits explore these suffocating ways that the bodysuits confine women. So then I have these like embroidered pieces. And I think the embroidered pieces really show this obvious effort through this tight labor-intensive embroidery, which is replicating the effort of maintaining the pursuit of beauty. So they're kind of hand in hand there. And I wanted the embroidered sections to really like suffocate the portrait and appear very tight and repetitive. I also wanted this machine-like quality to go into the embroidered pieces, although they are embroidered by hand, which took a long time. And I wanted to kind of ask the viewer here the origin of these stitches in direct comparison to that tedious and repetitive and perfected pursuit of the beauty practice. And it also examines how women's work has shifted from the practical to nonsensical, driven by the patriarchy to continue to control women. And you could say that beauty maintenance is the new woman's work. Fibers and embroidery and sewing are so heavily weighted within women's work throughout history. So I wanted to take that idea and connect it to this new woman's work, this idea of maintaining that beauty standard, and bring them together. And the color pink was super important within the works. I love pink. It shows up in a lot of my paintings. But I think pink is it. Well, I know pink is this woman that, oh, sorry, it's this color that's assigned to women upon birth. It's assigned, it is there on every gendered item of clothing or toy or whatever. It's very weighted, especially within Western culture. And this color, it means cuteness and sweetness, but it also means this physical weakness or silliness. And I really hoped in the show that I could tie the color pink with these strong women that I painted and kind of start to shift that traditional meaning to mean something of female power rather than what we know pink of originally. Okay, so now I'm going to take a little shift into doula work and talk about everything doula, which I'm excited about because I've talked a lot about my artwork, but I haven't necessarily talked a lot about doula work. So this is really exciting. So becoming a doula, how did I get here? First, I think that the SAOP, the Rape Crisis Hotline, really inspired my passion behind women's health and advocating for women. And the lack thereof in the medical system today. I was always interested in that anatomy and advocating and informed consent, but I didn't want to become like a nurse or a doctor. That was not in the cards for me. I won't go further on that. That just was not happening. And so I didn't really know what a doula was until my friend was in school to become a midwife. And to be a midwife, you have to take a doula training. And she was telling me about it. And I was like, this really sounds perfect for me. I really think this would be great. I've always been fascinated by birth. When I was growing up, and maybe you would know this show, it's called The Birth Hour. It was on TLC. It's like a 30-minute episode where a couple is shown prenatally and then literally giving birth and then immediate postpartum. And I grew up watching this as like a 3-year-old, which is a little questioning for my parents to just let me watch this, but I was really into that. And so I really think this like kind of instilled this fascination about childbirth. And then obviously just like this passion for supporting women. I think that makes sense. This is a photo of me holding a placenta. And I look so happy. So I'm so happy for myself that I'm here. What is a birth doula? What's the role of a birth doula? So upon hiring, I'm an independent worker. I work for myself. Upon hiring, I guide my clients through pregnancy. So we're talking all the way through pregnancy whenever they hire me to the birth. We're talking about appointments and non-stress tests and bodily changes. And there's 101 things that happen that are unsuspected in pregnancy. So we're really helping to guide them through that. I also meet with the clients and their partners prenatally to provide prenatal education and informational support. That's what I'm doing here in this photo. And I was so lucky that my clients took these photos of me because it's awkward to ask people in their space to take photos of you. So anyways, thanks to them for taking this. They're good reference photos. I also provide 5 weeks of on-call time per birth. So when you find out you're pregnant, you're given an estimated due date. That's at 40 weeks. I'm on call from 37 weeks to 42 weeks. It's awesome when people birth at like 38 weeks, and then I have some free time of not being on call for them. But oftentimes they're going to that like 41, 42 week mark. I join my client once they're in labor, no matter what time it is, no matter what hour of the night. And I'm there continuously until baby decides to join us. So during that time, I'm at the birth itself. I'm providing physical support to the birthing person through rebozo techniques, sacral presses, hip squeezes, labor positions, massage, all the things. Here in this photo, I'm doing some rebozo technique, which I can explain later if it's wanted. I'm providing emotional support, which could look like affirmations and encouragement, and that informational support, which is talking through different medical choices, talking about informed consent, or just giving my client like the space that they need. Also, there's a lot of partner support. It can be super overwhelming for a partner who's never seen a birth to all of a sudden be witnessing their like most loved one in this very intense situation. So there's a lot of, I'm giving a lot of support emotionally to the partner, and then also giving them ideas on how to support their partner that is birthing. I am trained in pelvic dynamics, so I guide my clients through laboring positions that allow baby to have the most optimal space in the pelvis in hopes to shorten labor time. And I coach my clients through pushing in order to lessen the severity of tearing and pelvic floor health issues. I assist in immediate postpartum, which is like skin to skin, the first latch, breastfeeding, guidance with newborn medications. And I provide postpartum support. And that postpartum period is considered the 4th trimester. And it's the first 3 months after baby is alive, that baby is born earthside. Okay, so we can't talk about doula work without talking about obstetrics. So I want to just kind of briefly chat about the history of obstetrics and hospital policy. So most of the births that I attend are at the hospital, which has given me some good insight on the not so great things about birthing at a hospital. And unfortunately, an epidural, which is a pain medication used to numb you from the belly down, during birth, is only given at the hospital. So a lot of people just, that eliminates the birth center and home birth or like other birthing options right away because they want an epidural, which is totally fair. And people want the safety of birthing in a hospital. A lot of things can go wrong. I totally hear that. We see that. So I think that picking the hospital practice that's right for you is very important. Some people just like you're already in care when you're seeing your gynecologist, and some people just go straight into care for their pregnancy and birth. But really kind of shopping around hospitals is something you can do. A lot of people don't know that. And picking and asking questions. What's your cesarean rate? What is your induction rate? What is your average labor time? How likely will I be able to see my doctor? Are there midwives in your practice? There's so many questions you can ask. So they're just kind of like a solution to that, to sometimes hospital births not being the most gentle. Talking more about obstetrics. So obstetrics is rooted in the white European body, as most medicine is, unfortunately. So there's a lot of internalized racism within the system. So we're seeing higher mortality rates in birthers of color than white birthers. We're seeing higher fetal mortality rates in babies of color compared to white babies. We see unjust treatment happening to birthers of color, like the denial of pain medication, the lack of communication, bedside manner, compared to those of white birthers. And it's so crazy and so eye-opening that there's literally nothing to explain that other than internalized racism. So that is just so wild that that still happens. We also at a hospital can oftentimes see what is called the cascade of intervention, which affects every single birther in the hospital system. And it can affect like a birth center as well, but typically at the hospital. This cascade of intervention can lead to higher rates of postpartum depression and postpartum anxiety, birth trauma, birth injury. And what this is where it's the snowball effect. So you kind of go in with one unnecessary intervention, which then calls for another one and another one and another one and another one, ultimately leading in some choices that maybe weren't needed and not wanted. So just there's this sometimes like a blind trust in medical professionals. And I really want to give my clients the space to ask questions and make informed choices on what's best for them, rather than just kind of like going run of the mill, doing whatever their doctor says is best. Like, let's hear the choices and let's hear why that's best. So the benefits of a doula. So studies show that people that have continuous support of a doula are about 15% more likely to go into a spontaneous vaginal birth, meaning not get induced. They're less likely to use pain medication like morphine or an epidural, but rather use other pain management options such as movement, massage, hydrotherapy, affirmations, education. Labors are estimated to be shorter with the use of a doula, oftentimes due to just movement and encouraging movement and going back to pelvic dynamics. There's about a 31% decrease in the risk of being dissatisfied from your birth experience, and therefore less likely to suffer from PPD and PPA postpartum. Here's me with my client. She's great. We look so happy. Sustaining the work. So unfortunately, doula work has about a 2-year turnover rate because it's very tough on your physical and mental health. It's a rough job. Like I said before, we work for ourselves, so we don't have benefits. I pay for health insurance. That it can be big if you have like a family that you need to support and you don't have benefits. We're on call all the time. So that's why I unfortunately can't be there today. But it's awesome that I'm here over Zoom. So I'm so glad that I had this opportunity to still chat. We stay up through the night. We can't really make too many plans that are set in stone. We're tired, but how to make the work sustainable. For me, I've really benefited from partner support. So I'll take on a client with a partner or backup support. So even if it's just like a sole client that I'm working with, I'll have a backup, which is what I'm doing right now in case one of my clients go into labor during this talk. Someone is covering that, so I don't have to worry about it. Self-care, a lot of it actually is like physical health. Making sure that you're taking supplements and vitamins and not getting sick, and physical health. It's such a demanding job, especially when someone's laboring unmedicated. You really have to keep up with them. So like working out has been really helpful for me. And then lastly, taking breaks, obviously, like every profession. I take a vacation in the summer, I take a vacation in the winter, and no one can bother me during those times. Okay, so now I want to combine these two things. And I want to link the conversation here with also just saying disclaimer that these are new ideas and I don't think there's any right answers. And I would love to hear your opinions and thoughts like behind these things that I'm about to talk about. So I'm wanting to link this beauty as currency for women to the rejection of that concept during birth. And as now I'm seeing this as a doula, this body of work as a doula, and then also just like as a woman who's getting older every year, as we all are, like you can have a different mindset and a different viewpoint on these things. And I want to be clear when I'm making this connection that this isn't a link to one value being beauty and then switching that value to being able to birth, because obviously many women can't birth or don't want to birth, but rather notice that the opportunity to reject the all high being power of beauty in this culture. And my biggest takeaway from this connection that I'm starting to delve into is that birth is this radical form of rebellion against the patriarchy and against beauty as currency. And also the act of choosing to give birth or not to give birth in itself is this rebellion that I'm noticing that women are finally starting to have a little bit more of a choice and there's slightly less judgment around not having babies. And with saying that, I have to go into, it would be ignorant for me not to go into what's happening right now, where that right of choosing whether you want to be pregnant or if you want to get an abortion is being taken away from women. So I have always been very passionate about pro-choice, but I never thought about it in terms of birth. I just thought about it in if a woman doesn't want to be pregnant and if a woman doesn't want to have a kid, they should not have to have that. However, now that I've seen all of these births, you really, it opened my eyes to how absolutely messed up it is to make a woman go through birth. No matter what, it is a trauma to the body. And having abortion care taken away from women is obviously just appalling, but especially seeing it through this new lens that I'm seeing it through of giving birth. And to tell a woman, or in this case, like a child, that they have to birth is incredibly traumatic. And it's also, like I mentioned, a huge trauma to the body. And my heart just breaks knowing that women are having to go through this if they didn't choose to. And I think it would be very beneficial for people that are very pro-life for others, not themselves, but for others, to have to be educated on childbirth. And see how wild of an experience it is. Even if it's a C-section, even if you have an epidural, it's still like a major thing that's going on, especially for people who did not want to do it in the first place. So that's kind of my thought there. And I'm really excited to continue to flesh out this idea and continue to work as a doula and see how it influences my practice and continue to see where this work leads me. So that's the talk. I would love to ask or answer questions. My art Instagram is listed here and my doula Instagram if you want to check me out there. And then I also included my email. If you want to reach out, I would love to talk about your artwork. And yeah, that's it. So thank you so much.
Do we have any questions for Paige?
Are you still actively doing like work that is like related to this topic or just in general while you do doula work?
Yeah, so that's a great question. I'm just gonna go back to like a image of my painting. So yeah, so it was, I would love to just like delve into this a little bit. It is quite a shock when you're in grad school and or in undergrad and all your time is spent painting, and then you leave grad school or undergrad and you have to get a job and you want to keep up your painting practice. And so that was really hard for me, and it took me a while to like get into a rhythm with this. I think that I'm finally, literally 3 years later, in a good place of my art practice being a part of my job and of my like daily life. And so that's good. It definitely took a while to figure out. But luckily my work is very rewarding and very inspirational to me. And I think that I have always kind of had this like feminist theory in the back of my head so that it will always influence my work. But I'm also not scared as much to break away from this subject matter as I once was, like in grad school, where in grad school I felt very connected to this, and I really didn't want to kind of come away from that. And now I'm trying to learn to paint more for my own enjoyment rather than to like keep this rhetoric up of feminist theory.
Yeah. So I was curious, what is it like coexisting or working? So you say that you're doula and you go into the hospitals with your clients. What is it like coexisting amongst like healthcare workers at the same time in the current culture of the healthcare system?
Yeah, that is such a good question. So that's like a huge thing that we deal with as doulas. So unfortunately, sometimes, especially within the hospital space, doulas can be seen as annoying because we're sometimes fighting back on what the routine is for that birth. And that does not look like with aggression, but that just looks like, can I have some time to talk with my client about their choices here? And that can be like a big hindrance to nurses and staff doing their job. I try to be very friendly with everyone, and it really works out for me, which is nice. But I want to show that I'm here to help them and make their job easier, and make the labor smoother than like be a hindrance to them. I will say too that oftentimes, like sometimes the nurses who are really grumpy about doula support, they're not there postpartum. They're not there 3 months postpartum when the doulas usually are. So we see birth injuries a lot. We see a lot of prolapses. We see a lot of tears. We see a lot of different breastfeeding issues. And that's just like with the postpartum healing, let alone baby. So we have to remember that too, that our biggest goal is for our client to have the smoothest experience possible. Our goal is not to make the nurse feel comfortable, but it's a hard line to deal with. At home births and birth centers, you do not get that pushback. Everyone is used to doula support. It's just pretty much every person that's birthing at home or birthing at a birth center is likely to have a doula. So we don't see that pushback there, but it certainly exists at the hospital.
How did you stumble upon the doula? How did that happen?
How did I become a doula or be interested in it?
Was it while you were in grad school? Or was it after?
Yeah, so it was during grad school. So I decided my second year of grad school that I was interested in doula work. And so I decided to go ahead and take a doula training course. And I really wasn't sure literally up until I was balancing going into academia and then also balancing doula for a really long time. So I really wasn't sure. But I decided to start my training because I was like, well, if I do a training, it doesn't matter if I become it or not, it'll still be informative to my work. So I did that while in grad school. To be honest, I did it secretly. I didn't tell anyone. There was a big push in my university for people to focus solely on their work. And they would not be happy if I was doing this like whole training. So I secretly trained to be a doula. And then it really worked out for me because I am a doula now. But it was something that I did get a little pushback from for sure.
Yes, when I was looking at your exhibition earlier today, the faces that were contorted, I actually saw them as births, as a person crowning in that process. And I was wondering if you could talk a little bit about those images of the contorted faces. And just where are they in relation to those that are just looking directly at the viewer?
Yeah, it's funny you mentioned that. I totally agree with you that they're very facial presenting birth images. I've only seen one facial presenting birth, which it's quite crazy if you look it up. It's where instead of the baby's crowning on the top of their head, they're crowning literally with their face. And it looks so much like these embroideries. Of course, these embroideries are older women, not babies, but you still really can see that smushiness within the faces. I think that when I was creating these works, I really wanted this suffocation of the bodysuit to exist. And I didn't want it to show up in every piece, like the painted figures, because I also wanted to talk about this complicity that I was experiencing with beauty as in currency. And I was kind of noticing on my own complicity of this throughout my whole life. So I didn't necessarily want every single piece to be this struggle to maintain this suit. I think that idea of complicity and confrontation, I still wanted to be relevant. But with the embroidery pieces, I thought that was kind of a time where I could do more of this suffocating work with the texture and the dimension of the embroidery. And it's funny how subconsciously everything is really related, and these totally look like these birthing people coming out of these bodysuits, which I also think could be an answer of a solution, or an answer that people are radically going against this idea of beauty as currency, that we're being pushed out of the bodysuit. in relation to also that suffocatingness of the suit. So it's funny how things pop up. And at the time of creating these pieces, I was still very much training to be a doula. So it's funny how everything is connected there.
Molly?
So I saw an immediate connection with the way you paint skin and Jenny Saville, particularly person. And then the image behind you looks an awful lot like a Jenny Saville as well. And I really admire the feminist statement she makes with her work. I wonder if you can speak to how she influenced you, because I definitely feel like the way you use paint is similar.
Yes. Yeah, I mean, Jenny Saville is amazing. Yeah, this is a piece that I did. Half of it, the reason why it's here is to cover up my kitchen, but the other half is to show other pieces. Jenny Saville is made, I actually saw one of her pieces for the first time in a New York City gallery post-graduation. And it was so wild to see one of her pieces in person after studying her for so long. Jenny paints with an aggression, and every brushstroke really isn't just a brushstroke, but it shows so much fight and determination, especially for this woman's body. And she also paints a lot of herself with her own children too, and depicts like what that looks like of motherhood, which a lot of people aren't doing. Another amazing artist is Carmen Winnett. And she showed at the MoMA with this collaging piece of birth. But it's very cool to start seeing birth in art, which is relatively new, even though obviously birth has been around forever. But with all that said, I really took a lot of inspiration from her, just especially having this living artist that is creating these visceral works. It was very inspiring to me, especially being able to see her work in New York City. But yeah, I think like just studying her work for so long and finding my own voice, I think that when I was in my first year of grad school, I made a lot of pieces that were like mock imagery of Jenny Saville's paintings, and I got a lot of shit for it. Like I got pointed out that it was too much. So kind of finding my own voice while still taking that inspiration, especially within the brush stroke. I was able to kind of see these pieces through my own lens and take less direct influence. But she's incredible, and she's always been one of my favorite painters ever.
Questions? Well, thank you so much, Paige. It was awesome to have you come and join us and to give this wonderful talk. And we appreciate it. Thank you so much.
Thank you, guys. It was so fun to talk. I'm going to go back to my last slide if anyone wants to take a picture of it or anything. But thank you so much. I really appreciated talking about my art practice and my doula work. And please reach out and follow me on Instagram. And yeah, thanks. Thank you again for the opportunity.